next speaker is Dr. Tara Madhyastha. She is a computer scientist interested in Parkinson's disease and using imaging to find out more about PD. So,
hi, thank you. So I'm going to talk to you about an NIH-funded study that I'm running at the University of Washington, which is dealing with intrinsic brain activity and cognition in Parkinson's disease. And to look at that, we're looking at simultaneous EEG and fMRI, and I'll explain how that works. Our key question here is, what can intrinsic brain activity tell us about cognitive impairment in Parkinson's disease? So all of you, while you're just sitting at rest and letting your mind wander, your brain is active. And it's active in a really rather interesting sort of way, which gives us a lot of information about how it is working and its health. So fMRI obtains a three-dimensional image of the brain every approximately 2 seconds. So you get this four-dimensional time course of your brain's activity. It's sort of a proxy for brain activity. And what happens is you get a signal. Let's look at sort of this blue area here. Over time, you see that the signal in that area goes up and down. Not in a sort of a regular way, but in a way that's got a lot of variability to it. If you look at another area, let's look at these two areas here that are in orange. You can see that they go up and down too, but they kind of go together. And that's the interesting thing about regions in the brain that work together, is that they vary together as well. And they allow us to identify networks of brain regions. One of the problems that occurs in cognitive impairment is that networks of regions are not working so well together. So you wouldn't see their lines go up and down together as clearly. And also you wouldn't see things like the blue line here, a region of brain areas which are active when people are performing a task. Those are, we call them anti-correlated with the red and the yellow regions. These are areas that are active more when you're thinking to yourself, internal mentalizing. So this pattern of activity of the brain has to be just right. And when it changes, it tells us quite a lot about the neurotransmitters, the dopaminergic system, the cholinergic system, and things that are going wrong. So what we're trying to figure out is exactly how to untangle that information that is in there. This is the kind of task that we give people who've come to our study. What we're trying to do is we're trying to understand, do we have to give you this nasty sort of task, or can we just look at your brain while it's resting and tell everything that we need to know about how you will perform on this task? And that is the basic question. This is, you won't be able to really see it very well, especially from the back in the room. But basically what's going to happen when I play this video is there's this little X up here, and we ask participants, research participants, to focus on this X. And then they're going to see patterns of dots move in particular ways. And we ask them, we give them about 20 minutes of training and ask them to tell us how the dots are moving relative to the X. And it's a really hard task, but it has to be in order for us to really sort of strain your brain in order to measure these changes in network activity. So let me see if I can play this here. So the dots are wiggling. There's a little arrow here, and that goes on and off, and you sort of are asked to give a judgment about how these dots are aligned with respect to the X. It's really challenging, and we change it up a bit. We also ask you to not just make that judgment about the orientation of these dots, but to also say, well, let's now reinterpret these arrows and then tell us whether the change is different from the previous time we asked you to make a judgment, so that it becomes a memory task. And so with the same stimuli, we are able to give you two different tasks, and we can see how your brain is different in both ways. And we have the flickering that you see there because we also use EEG, so we're able to look at these electrical signals and determine whether you're really paying attention or not, because it's hard to pay attention. So we need some sort of marker of that, and that's what we use, because otherwise the data would not look very good. Whoops, okay. So this is the research study design that we have. We have 70 people with PD, 40 controls. we put an EEG cap on you and we make you practice this terrible task and do the EEG alone. And the reason we do this out of the scanner at first is because the scanner, being in the scanner with the EEG cap on, can sort of change the signal, and we want to make sure that we've got a sort of a double standard, so they're able to make sure that we have two measurements to get it right, that we're not just looking at noise or something like that. And then you go into the scanner, the fMRI scanner with the EEG cap on. You rest for a little while where you just look at a little X, a little cross on the screen, and then you do the memory task with those flashing dots, and then you do the attention task, or the other way around. And then 2 years later, we ask you to come back and repeat this protocol. So this is the study design, and basically the idea is, to summarize these aims, the gist of it is we want to see whether or not the activity of your brain at rest, how that changes when you do a task, and whether or not the degree of that change predicts how you perform on that task. And if we know that, then we know quite a lot about you. That means that we can look at your resting state data, that's the data when you're not performing the task, and we can determine sort of what might be going on in your brain. And that allows us to pick some sort of potentially better drug therapies, to put you into a specific individualized clinical trial based on what we think might be going wrong, and to predict how you might progress. And all of these things are very, very important towards achieving this goal of personalized medicine. And one nice thing about this kind of imaging is that fMRI it's one of the few ways we have of looking at the brain that's not invasive. We don't have to inject you with anything. You can rest quietly in the scanner. You don't have to be concentrating. And it would be very nice if we could learn how to get the information that is in these images out, which is a very interesting type of problem. So I implore you, as everyone else has today, to get involved. You have this card that we made in your swag bag. And to make this, I asked my research assistants to try to take some of the images that we use in our analyses and to render them as art, with the goal of conveying number one, how beautiful I think these types of images are, but also how valuable and how unique they are. One of the ways, I think, in which we can leverage this type of research data to achieve personalized medicine is by getting a lot of it. Because every person is different, there's a huge amount of variability, and so we really need to analyze a lot of data, and not just the imaging data, but biomarkers that come from other sources. So if you participate in genetic studies, or if you give blood, and you have other sorts of, or lumbar puncture biomarkers, things like that, those kinds of things are very, very important towards understanding the underlying mechanisms for the fMRI variability that we see. So you as research participants are incredibly valuable. And I've used many, many, many data sets from many sources that are besides this study in order to come to some of my understanding. But I also need to thank the researchers who've done a lot of this work. So besides the research coordinators who you typically encounter, there's a staff of researchers and scientists behind the scenes. And these are just some of them, with Mark Pettit at the bottom here wearing one of the EEG caps to demonstrate. So thank you very much.
One question for me is, who are the study participants you're looking for, and do patients need to come off medications to participate?
Yeah, sorry. This study does not require that you withhold any medications. We are still looking for a few people with PD and a few controls of somewhat like age 50 to 70, because we're trying to balance the ages. So if you are interested, please pick up a flyer at the booth, the WPR booth, or on your card. The back of it will tell you how to get involved. So thank you.